Hello and welcome to this new video where we talk about the latest advancements of AI and how it's going to benefit the lives of so many doctors and people in the healthcare industry. If you're a medical student, if you're a doctor, if you're a nurse or somebody who just works in the healthcare industry, this is the video that you watch to get yourself updated on the latest advancements in AI. This video will provide you the first mover's advantage and equip you with all the necessary information. With all the buzz around AI recently, you need all of this information in your arsenal to be a better doctor in the future. Let us start by introducing ourselves. Hi, I'm Dr. Raj, and if you're on Instagram, you probably know me by Roy Covers. I am currently pursuing my internship from Gandhi Medical College in Secunderabad. And today I'm here with a very, very special friend of mine since the very beginning of college. Here's Dr. Saketh. He keeps himself updated on all the information that you require regarding AI. He is an AI enthusiast and he has been following this space for a very, very long time. And this video is basically a culmination of all that information that will be helpful for all the doctors and medical students and healthcare professionals out there.
Hey guys, I'm Saketh and I'm an intern and I'm a batchmate of Rajesh. Yeah, let's begin the podcast.
We are here to discuss a few of the essential tools that you need to know first of all and that you need to inculcate in your practice soon. All these advancements are going to help you a lot in your future. So let's start with the very first tool, which is Saketh.
I guess everybody already knows about the first app that we're going to talk about. It's ChatGPT. And so, tell me what you know about ChatGPT.
So what I have found out from the internet is that it is a large language model and it can give you a lot of insights. It's basically a person talking back to you, and it has the IQ of a 14-year-old, like you were saying the other day, right? I don't know if it has grown since the time we have talked, but here it is. Let me just share a screen.
It's only going to get better.
It's only going to get better. 5 years down the line. If it is already a 14-year-old, it'll be a 100-year-old. I don't know.
No, we don't want a 100-year-old.
We don't want that. Okay, so let me share my ChatGPT screen. We have the plus subscription of it as well. So
Raj, how do you think ChatGPT would be beneficial for, say, for a medical student in his second or third year or fourth year of MBBS?
How
do you think they'd use it?
What I believe that how this could add value to them is a lot of topics sometimes are explained in very tough manner in your textbook, or a person might not be able to approach that particular topic or concept. And I think ChatGPT could actually show you a path how to memorize the whole thing, or how to actually go about starting to learn a new concept and how to memorize it, how to come up with mnemonics, how to visualize those topics. In fact, I have actually used it for a lot of my videos where I have to try to create a new mnemonic or try to build a memory map for a lot of my students as well. So that is how I use it. How would you use it?
I mean, that's an excellent point you brought up. The main reason for anyone in the educational space, especially a student, to use it would be to create mental models on learning how to understand the concept. It could be anything, a concept that's very difficult to grasp, like you said. ChatGPT could generate a visual representation of it, or even a mental model of it. It would really help us understand it and remember it for longer. We could probably do a demo and see how it. Also, I think the main issue with ChatGPT, I would say, is that not everybody can use it in the same way. For example, the kind of responses that you and I would generate also would be vastly different, even though we both want to approach the same question, because it's totally dependent upon the type of prompt you give it. Right. So the prompt is basically the instruction that you give the bot. The quality of your prompt will help is the one that's determining the quality of the answer or the output that you're gonna get in the end. So if you give it a very high quality prompt, telling it exactly what you want to know or how you want it to be explained, it's gonna do a better job at following those exact commands and giving you the appropriate output. Let's say, for example, someone is struggling to learn the collaboration cascade. Okay, so how would you ask it?
I would probably start with a prompt like generate creative way to learn the coagulation cascade. I would say include mnemonics to make it easier. I would also probably include visualization techniques. I think a better prompt would require a lot of thinking on my part as well, but this is something basic that anyone I think can create, right? Anyone who has access to this ChatGPT can create. So let's see what kind of output it gives basically. Now we could always ask it to summarize it and then produce something shorter.
So basically, it's trying to follow all the components of your prompt. That's why it's generating such a huge explanation. Let's say something more comprehensive.
Yes.
Like something that's compressed a little. Something like, say, guide me on creating a comprehensive mind map on the topic coagulation cascade pathway, helping me visualize the connections and enhancing my understanding.
Yeah. So this is where we have come so far. The answers are a little bit in detail, just like how we want it to be.
And so we could always refine the prompt a little more. And also with the help of plugins, we can actually form a flowchart. Let's try that once. Let's activate this plugin called diagram.io. Okay. Let's not say guide me, because then it's telling me how to do it.
Yeah.
So let's just say create a comprehensive mind map on the topic coagulation cascade pathway, and outline the important subtopics and explain each of them. In the end, create a flowchart explaining the whole process.
Let's see what it's already using the plugin. So basically, we can create diagrams wherever we want to, even if our textbooks are lacking a diagram where we want something visually stimulative.
And we could just ask ChatGPT to generate a visual representation of it, and that actually helps. So that tells you the important subtopics.
Yes, and we could basically go through the important subtopics and finish the whole preparation for this specific topic. Yeah.
So now it's already generated the important subtopics that we asked for it. We say, so the process starts with hemostasis, then intrinsic pathway, extrinsic pathway, common pathway, fibrinolysis, and the various disorders associated with all the coagulation cascade components, and therapeutics in the end. This is exactly how a textbook would map it out.
And it's important to note that these diagrams are not copied from the internet or anything. This is actually generating these diagrams. I think it's very important.
Exactly, yeah. And I mean, that brings me to one of the negative aspects of it as well, because there can be mistakes. So, though it is reliable most of the times, you always need to keep a check. So, I'd recommend using ChatGPT as not the primary resource tool. Obviously, you have to read your textbooks and your the educational resource that you primarily use separately. Use ChatGPT more of a memory or a revision or an explainer tool. Let it stop in the end. Yeah. Ask it to map out the extrinsic pathway and the intrinsic pathway as well. This is one of the rudimentary ways of writing the prompt, but just because we are generating all these prompts real time, but if you can actually spend 5 minutes of your time before asking ChatGPT,
so the output will be as intelligent as the prompt that we are feeding it with, basically, right?
Yeah.
Let's have a look.
All of you just go on to ChatGPT and try to prompt it as much as you can with the free version, obviously, and learn how it's responding to your prompts, and you only get better in a few days.
Yeah, that's pretty accurate. And it's crazy that all of this is generated by the AI and we had no part in it. Like, we didn't have to draw all these diagrams. We can just get a printout. How do you think, because I've heard you talking about how you can use it in practice or for practicing doctors, and how do you think a practicing doctor would benefit out of ChatGPT?
Precedents, for example.
Yeah.
Let me talk about one thing, okay? How do you think ChatGPT would benefit in the field of medicine compared to the field of surgery? Like, why do you think ChatGPT is more useful in medicine compared to surgery? What would you say to that? Or would you say it's more beneficial in surgery?
I would definitely say it is beneficial in medicine because it requires a lot of brain power, medicine, while surgery is more of, you go there, get the physical job done and it's over.
Imagine a first year postgraduate. He is working in a hospital right now. How would he approach a case? There's probably like a 14-year-old girl who came with bleeding manifestations. Okay, you would first ask for a history. You would take a proper history. You would do a proper examination of the whole body or examination of the relevant systems, and then you would suspect something based on your examination history. You would have a set of differentials. You will send a list of lab investigations or radiological investigations, whatever it is. And based on the data that you get from both your lab investigations and your radiological investigations, and if any other, you're going to narrow it down further until you reach the most probable diagnosis.
Yeah.
turns out an AI can do that pretty well. Give ChatGPT the actual presentation, or not ChatGPT, any AI model that has been trained on a vast amount of medical data. Give it the actual presentation of a patient who presents to you. Give it the examination findings. Give it the lab investigations. Give it the radiological diagnosis, and it will do a pretty good job of scraping through all of its data that it has already learned from to generate the list of differentials that you yourself can come up with. It can do that faster than you, and it probably might spit out 2 or more differences that you probably might not have thought of.
Because an AI model will not have that bias towards what it has already seen or what is commonly presented, all of that.
Exactly. I mean, we as humans are definitely prone to biases. Like you said, there could be a number of biases, and an AI model will probably just operate based on data and nothing else. Because that's the only input it has. It has nothing else.
And the fact that it can cite all the latest information on it and then provide the information, a doctor could never do that.
Wants to go through the clinical plan, we could just ask any model that has been trained on medical data.
Let's bring up Medpalm 2 as the next AI tool then.
Yeah, definitely. And let's get Medpalm 2.
Okay.
It's not open for anybody yet, and they'll probably start rolling out the beta paid access through Google Cloud for a select number of people later, that too. But right now we just have demos and trailers of how it actually works, and they have actually published a preprint for it. There's GPT Neo, PubMedBird, BioLink Bird, but they are very substandard compared to
Medpalm
and Medpalm 2, both of them.
What is it different?
Came out. It had just been fine-tuned more for medical data, fine-tuned more for answering questions, all these USMLE-based questions, and see how you would react to answer those questions and how a bot would answer those questions. And if a bot is able to answer those questions better than you, that means it's doing a pretty good job.
It's doing a pretty good job.
Better than a doctor, right?
Yes. It's actually scary at the same time, because I do not want to be competing with an AI model and then fail after that.
As a doctor, I mean, I don't think an AI can formally personally connect with a patient.
No, because if you think about it, an AI will be more ethical in terms, we were talking about ethics the other day. Like, how do we talk to a patient? How do we come up with a better response? Don't you think that if we can just prompt an AI, like, be this much emotional or be this much factual about your conversation with the patient, I think it will do a pretty good job, right? Even more, it'll be more sensitive than a doctor sometimes.
You're right. Actually, you know what? You'll actually read that in the preprint of Medpalm 2, that it was trained on ethics as well, on medical ethics as well. And surprisingly, it spit out really great answers when it was faced with questions of ethical dilemma on how to break out news to a patient, or whether or not to break out news to a patient, at what stage to break it out, and what conditions you need to explain, and how do you need to explain. All of these questions were surprisingly answered very, very well by Medpalm 2. Medpalm did a better than a doctor.
I think I've seen the statistics somewhere on the internet, like there was a graph, a doctor performed how well and the Medpalm 2 performed.
Medpalm 2 has gotten 86.5% of the questions right. The accuracy of the bot is 86.5%.
There is the human being here on this graph. I don't see the...
That is higher than average.
No, 86% of the USMLE score, eh?
Yeah.
Wow.
I mean, assume it's USMLE scoring, so it's better than the average physician. It said that Medpalm 2 achieved an accuracy of 86.5% on USMLE style questions in the MedQA sheet.
The ethical thing that you were talking about, how it has already surpassed a human being's this thing. And it takes out all the guesswork out, right? As a human being, I would be bound by emotions. Should I tell the patient this now? Should I tell it later? It takes out all the guesswork and statistically tells when you have to deliver what kind of news. And I think that is key.
Let's just told a little more.
Multiple choice.
Yeah, so this shows, it shows how well all the models performed on each data set, on MMLU, anatomy, professional medicine.
Subject-wise. Damn.
MedQA.
Yeah.
Yeah. Then Medpalm third table, the third row. Yeah. So it says in the United States, age-adjusted breast cancer mortality is about 40% higher among Black women than among non-Hispanic white women. Despite the lower incidence among Black women, explain this. Okay, so Medpalm, the previous model, spit out a very average answer.
More likely.
The scalp is more likely to be diagnosed at a stage in black women and white women, and black women are more likely to have a more aggressive form of breast cancer. Okay. So let's see what Medpalm 2 says. Read it out.
Black women are more likely to be diagnosed with aggressive breast cancer subtypes such as triple negative breast cancer, which tend to have poorer prognosis. Black women are also more likely to be diagnosed at later stage of disease when the cancer is more advanced and difficult to treat. In addition, black women may face barriers to accessing high quality healthcare, which may affect their ability to receive timely, effective treatment. These factors contribute to the higher mortality rate among black women with breast cancer, which is
That perfectly answers the question.
perfectly answer the question every possible way. Third question, yeah. Comes to the office with 3-day history of sore throat, non-productive cough, runny nose, and frontal headache. Says the headache is worse in the morning and ibuprofen does provide some relief, and which of the following is the most likely cause of the patient's symptoms? So the explanation.
From all of this data that's it's been given, it's gonna say the answer is D.
D.
And that is rhinovirus. It's most likely rhinovirus.
Yes.
So like a URTI basically.
Yeah.
That's what it's thinking. So how would a doctor approach this? He would go through all the presenting complaints. He would say non-productive cough, sore throat, runny nose, frontal headache. Seems like a URTI, right?
Yeah.
And he says the headache is worse in morning and ibuprofen does provide some relief.
Yeah.
So it is an inflammatory condition, an acute inflammatory condition, like a rhinitis. And he has had no shortness of breath. So you're eliminating any cardiac causes or any LRTI causes.
Yes.
Then you're saying medical history is unremarkable. So you're ruling out any comorbidities with the past history. Okay. And you're saying the pulse is normal. Temperature is slightly elevated, which is okay. Respirations are normal. Blood pressure is normal. And examination of the nares show erythematous mucous membranes, which is in line with what we already thought of. And examination shows erythema and follicular lymphoid hyperplasia. If lungs are clear to auscultation, then it's not an LRTI. You can eliminate all the causes of LRTI here.
Yes.
So probably eliminate mycoplasma pneumoniae because it causes a pneumonia picture. And you typically have auscultatory findings.
And it would have come up with all the explanation in like fraction of second, right?
I came up with an explanation just like how a doctor would or a student would approach this question.
And imagine in a life or scenario, in an emergency scenario, like a doctor would have to think and come up with the explanation. It would be very time-taking process. But I think this could reduce that time and be very beneficial in a life or death scenario. Of course, in a rhinovirus, in a normal cold, it's useful. But in a emergency setup, it would be very useful for all the information to be presented to it and for it to come up with the DD, right?
Yeah, but I don't quite agree with that fact that it probably might be beneficial in the ER setting. Is that is purely driven on the
Instinct.
Yeah, it's more of the instinct or the ability of the ER doc to come up with the differentials. Like you said, it's life or death, and you can't depend on an AI bot to come up with a differential or a diagnosis there. You need to act immediately. I would describe this as having a consultant on your device.
Yeah, that's a very good way to look at it.
Help augment a consultant's practice because, I mean, he has tons of experience on how to deal with all these conditions. But for a resident or someone who's training a medical student, it would be such an incredible and powerful tool. Yeah. So it's like a real-time, on-demand consultant on your phone.
Exactly. What is the role of a future doctor 10 years down the line?
I think the future doctor 10 years down the line will be using one of these tools in his daily practice. See, it's not to replace the doctor. Like there are tons of programming tools that are able to generate code. That doesn't mean developers are out of jobs today.
The role will be different.
Yeah, I mean, they're just gonna have to equip themselves, learn about all of this, and just stay in the loop.
No, this will be very useful in remote areas where you don't have access to consultants, but you...
True. Definitely true.
I mean, a general intern, of course, even if your Medpalm 2 is a little bit inaccurate, there'll always be a doctor, even a basic level doctor and intern who will actually, it has to pass through a sniff test of that person, right? So, even I think remote areas and places that don't have access to modern healthcare, that would be really helpful there. So yeah, the next tool is
The next tool is called Gamma app.
All right. Gamma app.
So this tool, I found this during one of my psychiatry. So I was supposed to make a presentation. So all of the interns, basically first-year psychiatry, have to make a presentation on the topic allotted to them. And I was allotted the topic of eating disorders. Okay. And I had to generate a presentation on that, but I was too lazy to do that, honestly, because I wanted to do other stuff.
Yeah.
And I wanted to find a tool that could generate a presentation for me so that I would have to work, like spend lesser time on it. And this is where I found this app. This is useful for everybody. It's not just medical students. Medical students obviously have to prepare a lot of presentations. It could be useful for doctors as well. Physicians who take classes, professors who teach classes. It's definitely going to reduce the time you spend on creating a presentation from probably from 100% to 30% or so.
It being all the creative, designing the backgrounds, designing the colors, and makes you want to focus on the intellectual parts of the presentation more, right?
Exactly. Yeah. So let's try something. So this junior who stays right next to my home, right next in my neighbor. So we just wanted to create a presentation on the classification of antiarrhythmics.
Should I just
I told him about this app. But let's try it ourselves.
Okay.
A presentation about the classification of antiarrhythmics.
Yeah.
I explain classification, a mechanism of action. What are we want to know when we are looking at a class of antiarrhythmics? Classification, mechanism of action, side effects, and the examples of each class.
Like if we have like a presentation,
you don't have to say
10 minutes, for example, can we even add that as a prompt and it will come up with exactly how long?
I haven't tried it yet, but probably. I'm pretty sure. If not this, there's some other tool that can.
Yeah.
There is something called Tome. Yeah, there's something called Tome.app, but it's not as good as this. It's a Tome. Tome is a great app as well, but Tome has an image generation feature as well, where it tries to generate an image relevant to your slide topic for every slide.
The outline,
I guess. But maybe you could refine the prompt a little more so that it gives you the slide info for each class, like class 1, class 2, something like that. I think the prompt is getting too confusing. We need a clean prompt.
Each class should have a slide of its own. Should I go ahead with it?
Let's see. I just want to see it. I just want the context to show class 1, class 2, class 3, something like that.
Yeah. Wow, it has actually done it. It has provided it.
Perfect.
Excellent. Awesome.
Continue something that I wanted. Yeah. So this is an example of how you can restructure your prompts.
Let's become designers for some time now. How would you want it to be?
Let's go with surprise me.
Oh, there is an option called surprise me. I hadn't seen that. Totally surprised me.
Okay, let's just choose this.
Okay, next. Let it take care of business. And damn, it gave a picture as well. The sodium channel blockers looks.
You see, Pavits try to not stock images, but Tome wouldn't do that. Tome would generate that image from DALL-E.
And that would be a horrible image, to be honest, for something that's scientific and this thing. It wouldn't.
Yeah.
Because this requires the integration of someone with the knowledge, someone with designing capabilities, and someone with organizational skills. It would require a whole team to create this, but now it's just a click away. And damn, this is so good. Let's try to see from the beginning. It gave the classification.
It's pretty accurate. The image is pretty accurate, but again, you need to refine it a lot more. Add a couple of slides in the middle. You need to spend time, but only 20% of the time that you probably had to spend.
What is this button over here? Oh, you can add as well. I can add anything I want.
Add slides. Oh, I've changed the layout.
I could again prompt, for example, okay, I was talking about how the thing over here did not have classification. Maybe I'll add the classification here. This makes the job of a teacher so much easier because a teacher would have to generate slides, make slides, and excellent. Okay, this added it into this thing. I should have clicked on the other, but it's pretty good. It's very good that it has the capability to modify the presentation as well. You know, all these companies, they have like a team to make all these presentations. This is coming for them. Not replacing them, maybe.
It's going to help them.
Help them.
It's going to help them.
That's the word they're using. It's going to help them.
If they now they can sit at home and watch Netflix for an extra time that they have gained.
This was just a very small demonstration of how AI can change the lives of healthcare professionals. And we have a lot of tools in stock that we want to talk about and we want to make a video about. Do stay tuned for the next parts that are going to come. Those will have more detailed explanations of other tools which are even more helpful than these basic ones. We need to start somewhere, and we started at the most basic tools that we could find. Don't forget to like, subscribe, and put your thoughts down in the comments down below. Hit the bell icon and stay tuned for the next part with a lot more information and a lot more fun. Here's Dr. Saketh and Dr. Raj signing out. Hope you have a wonderful evening. Bye-bye.
Bye, bro. Bye, guys.